Hello, welcome to Mind Matters with Dr. Gochukwu Ojiako. In the last 2 months, we discussed anxiety disorders and its types. So, if you have not watched any of those series already, please endeavor to do so. We will include our YouTube channel link with the link of this particular video. So please feel free to use that to utilize our resources on the channel. You can view the anxiety videos or the ones prior. Today I am excited because we are moving on to mood disorders. Yes, mood disorders, which includes depression. So this is introduction to mood disorders. We focus on MDD, or major depressive disorder. Mood disorders are among the most common of all psychiatric illnesses. It has become increasingly common for mood disorders to be treated in primary care settings. Clients first present in such settings due to the high degree of somatic symptoms that accompany mood disorders. When we talk about mood disorder, what quickly comes to mind is sadness. Yes, sadness is a very big part of mood disorders. But sadness is also a common human emotion. It exists on a continuum, ranging from the absence of no depression at one end to pathological level that produce significant symptoms of a psychiatric disorder called major depression at the other end. So when we evaluate patients for depression, it is essential to distinguish between normal level of sadness and pathological level that is symptomatic of major depression. Major depression requires treatment and generally will not abate fully without therapeutic intervention. Untreated major depression predisposes individuals to other serious health conditions. So, pathological level of depression should never be left untreated. So, as I said earlier, sadness is a common human emotion, but it can be considered pathological or a symptom of depression if it is disproportionate to events and sustained over a long period of time. Sadness can be pathological if it significantly affects social functioning such as job, activities of daily living, occupation, and relationship with people. Sadness can be pathological if it significantly impacts somatic functions such as sleep, appetite, activities of daily living. It is pathological when it is clearly unrelated to any significant event or any identifiable event in a patient's life. It is important to note that cultural differences affect behavioral manifestation of depression. Also, mild depression can actually be a healthy reaction to stressful life events that can motivate an individual to deal with events and emotions. So one may be wondering, what exactly is MDD, or major depressive disorder? Major depressive disorder is among the most common of all psychiatric illnesses. It is a complex brain-based illness with primary characteristics of persistent disturbance in mood and excessive high degree of sadness that manifests with behavioral, affective, cognitive, and somatic symptoms. MDD can have a precipitating situation, event, or concern, but it also occurs without any identifiable precipitating life stressor or event. It significantly impairs one's daily function and goal attainment. It has a complex biological, biochemical, and environmental etiology factors. Some of the etiology factors of depression are biological. According to research, there is a clear genetic predisposition to depression. Having a depressed parent is the single strongest predictor of MDD or major depressive disorder. Children of parents with depression are 3 times more likely to have depression in their lifetime than the general population. They have also 40% chance of having depression before the age of 18 years. The earlier the onset of the symptoms, the more severe the depression. Another etiology of depression is endocrine abnormalities. Major depression have symptoms that suggest abnormalities in the endocrine system causes depression. Some of the symptoms that we see in major depression, such as sleep disturbance, appetite disturbance, libido disturbance, and anhedonia, are related to the pituitary and hypothalamus and the hormones that they produce. Also, abnormalities of the neurotransmitters, such as the dopamine, serotonin, and norepinephrine, also contributes to depression. So, major depressive disorder is a very vast topic. So, we are going to stop here for today. And in our future video, we will complete the discussion on major depressive disorder. Our email address is located in the description. So, please feel free to send us your general questions. We will randomly select questions to be addressed in our future videos. So, like, comment, subscribe, and share this video with your friends and your families. Thank you for watching. I am Dr. Ogachukwu Ojiako. Thank you.